I think what's most important and one of the biggest impact that the COVID-19 pandemic has thrown is for the world to realize that healthcare is at the center of all that we exist for. And until unless we transform healthcare, until unless we innovate around healthcare delivery, until unless we really converge technologies to really create more proliferation of healthcare services, we are not going to be able to really get there. So accessible healthcare is a good dream, but that accessible healthcare has to come on the back of technology creation. Otherwise, it's going to be very, very difficult because, as all of us have been discussing, that healthcare costs year on year are actually increasing all around the world, including India. So the convergence of technologies to actually enable accessibility should actually be the biggest lesson out of the pandemic. Just to give you a quick snapshot of where the Indian healthcare ecosystem sits. So we are, as a sector, about $370 billion this year. Healthcare delivery on its own would be in the region of about $80-85 billion. The rest of it is all the ancillary services, technologies, pharmaceutical, diagnostics, medical technology, everything all of that contributes to that number. What's important for all of us to see is, one, where is the healthcare expenditure as a percentage of GDP? We are amongst the lowest countries in the world in terms of the amount of GDP that we spend on healthcare, both public and the private side. In fact, on the public side, we're even worse because we spend less than about 1% of our GDP on healthcare. So India is largely private driven, if you were to say at a broader level. More importantly, if you see the per capita spend on healthcare, we are amongst the lowest there too. So there is a lot that needs to get done to get healthcare right for this country. One of the biggest opportunities, and again, as I said, that what the pandemic has thrown at us is the increasing digital adoption. And we've all realized over a period of time that as telecom, data, transferability of digital technologies comes together, there is a lot that healthcare can drive on. And that's really where the future really sits. So the future actually sits on that 975 million people who are going to have access to internet connectivity. And I think that's really the core and the crux of what we need to do over here, particularly when you are talking about transformation and innovation at a broader level. What is it really going to sit and ride on? So let's just quickly come to, obviously this was all as a part of the pandemic, but let's quickly look at healthcare in India. So, if you look at one in terms of the economy, right? So India is bound to become one of the largest economies in the world at the pace at which we are going today. This was a comparison that McKinsey did many, many years back, but I think we are somewhat getting closer to that. We are already talking about a $3 trillion economy going towards a $5 trillion. But more importantly, let's look at what the consumer perspective of this is all going to be. So if we basically now go back and see the private consumption that India is going to throw up, healthcare is going to be one of the biggest drivers of this change. As countries reform, as countries grow, as GDP grows, whether it is urban or rural, healthcare is always, and education are the two key drivers as a function of the GDP growth. So I think the journey that we have in front of us is basically to use healthcare as a key economic driver of change and transformation. So look at this in terms of the categories accounting for more than 80% of cumulative consumption in the next 20 odd years. Obviously, food is first, transportation is next, housing, and then healthcare. So I think we are all sitting and we all believe, and from the vantage point of all of us sitting over here, we know that this is how the spend is going to happen. This is how the transformation of the spend has also happened. So let's now quickly look at, and this is all thanks to the pandemic. And I think if we were to basically look back and say that can a crisis become one of the biggest opportunities of change, we are seeing that in healthcare. Not just as investors on one side, but also when you start looking at the way that the transformation is taking place in our healthcare systems, you can see there is a lot of consolidation taking place. There is a big movement in terms of the sector and the industry in terms of its growth opportunity. And therefore, digital impact on healthcare is going to be one of the biggest drivers of future growth. So whether it is the growing use of mobile devices, It's leveraging meaningful improvements and from operational efficiency creation. Um, you have tech-savvy patients. Obviously, everybody is today a lot more digitally savvy than what, say, a decade back people were, or even half a decade back. And last but not the least, I think we are sitting on a massive bunch of transformative technologies. I was just telling the group today, before coming here late night yesterday, we were looking at this company out of Switzerland called MindMaze, which is talking about digital therapeutics in the world of neurology. For stroke patients, their product now is US FDA certified, where doctors or neurologists can actually prescribe that product, which is a digital program for treatment of stroke patients. This is where digitization is actually heading. And there is a code now in the US for that, and there is a reimbursement around it. So we are literally at present and right now, if you look at the world of healthcare and look at all the transformation that's happening around us, we are at a great vantage point of change and transformation. This is interesting because this is the crux of all of this. If you take a look at mid-year of 2021, and the reason why I'm throwing back some of this data, because obviously the financial markets have changed a lot between last year and this year, but half year of 2021, the world raised more than $20 billion of funding around healthcare innovation. In fact, the full year of 21 was $40 billion of new capital going behind companies. That amount of capital obviously will give rise to a tremendous amount of change. And if you see, that's been disproportionate between the previous years. So in this one big change that happened on account of the pandemic and the rising thinking around digital as a way to go in healthcare has given rise to a massive amount of funding opportunity for health tech companies. India alone, there are now about 7,500 health tech enterprises, which together last year raised close to about $2 billion of equity capital. So there is a lot of change that's going around. Now, obviously, a lot of that has to fructify in creating products and services which can actually go into the hands of the consumer. A lot of it needs to happen inside our healthcare delivery systems to actually show that productivity enhancement can happen on the back of this incremental capital which has gone behind these technologies. So I think that's the good news. If you then take a look at, so this is just what I was telling you just now, that I think we're sitting at the cusp of radical change and where investor capital is going in today. And India is really one of the biggest beneficiaries of this change. In fact, if I were to see in our own world of equity investment, when we take a look at the last couple of years, incremental dollars have gone behind health tech versus what we are seeing on the healthcare delivery side. So there's a massive amount of new enthusiasm around the ability of Indian ecosystems being able to deliver to big change using digital technologies. Improving patient experiences, and Dilip is sitting here, improving patient experiences is on the agenda for all executives, for all healthcare executives worldwide, because of the dichotomy that has there always existed in terms of between healthcare provider groups and patient population in terms of the overall satisfaction rate that we have seen with patient care around the world, including India. So let's just quickly look at what is really big tech driving in healthcare. And I'll give you some phenomenal examples which are coming next, that the biggest tech guys around the world are actually putting in tremendous amount of dollars in healthcare, which is not very, very surprising, because I think after the entire e-commerce wave, people are actually thinking that the next big wave is going to be around health tech, and that's why everybody, and particularly the tech giants, are putting incremental amount of their resources and time in thinking about healthcare. So consumerization, and these are just trends, and let's not elaborate on it as a function of time, but consumerization of healthcare and patient experiences, patient connection, patient relationship, consumer relationship management, which we have talked about in all the other sectors which are related to services. I think healthcare is now getting there in terms of rapid adoption. Explosion of health data, and Chris and us were just talking about the fact that the amount of data that is sitting in healthcare enterprises in India is just so valuable, but it is not nourished. It is not channelized. It is just not getting converged. And so there needs to be a massive need for the convergence of this data for the world to actually dip into and therefore create greater unlocking of value for ourselves out of this country, whether we are on the public or the private side. There is a massive demand for AI, as all of us know. A lot of artificial intelligence today is related or relatively focused on the diagnostic side, and particularly on the radio diagnosis side. There is a big push around artificial intelligence, and I sit on the board of a couple of companies where I'm actually seeing it happen, where radiologists are able to report better because they are using some phenomenal AI tools for them to really give out better results and faster results. Enterprise interest in smart devices. I know many healthcare enterprises in the country are now working with many of these tech players to basically create new devices, and we will see a couple of them as we go. And last but not the least, everybody is trying to solve the same problem, whether we are here in India or the rest of the world, and that is about increasing cost. And a lot of it comes from the US, because US spends 16% of its GDP on healthcare. But the fact of the matter is that as currencies depreciate around the world, cost of healthcare is bound to increase, and that's a given. So let's look at all the tech giants and their push in healthcare. And in fact, I didn't know that Amazon today will actually call off its entire healthcare initiative, but that was one of the most celebrated activities that has been happening over the last 2 weeks, where Amazon was actually trying to buy one of the largest primary care services in the United States. But between Facebook, Apple, Microsoft, Google, everybody is universally looking at opportunities in healthcare. It's a great opportunity because when these tech giants actually go into the world of healthcare, there is going to be some great outcome, as they've shown in everything else. Zubabar. So if you just take a look at what each one of them has been talking, I think there is a focus over here, which is tilted and a very renewed interest. It's strange that this is a company which also creates the highest amount of mental illness in the world, and that he has to go and solve it. But this is the truth, that effectively Facebook is now trying to probably redeem itself out of all that it has done over the years. Blood donation, opioid addiction. I mean, this is what Facebook wants to actually get into over the next couple of years. Apple and Tim Cook talking about what's going to be their contribution to mankind, apart from the great phone that they've given all of us, but they want to make a big impact in healthcare. And I think that's one company which probably is at a vantage point above everybody else. They have so much of data from all of us sitting inside their devices that they can actually make a transformative attempt of changing the world of healthcare itself. This is really where Apple is concentrating itself, obviously health and wellness, but expanding the Apple Watch and everything else that goes along with it. Google, next 5 to 10 years, this is where their focus is. So can you imagine company after company in the space of technology is only talking and is incrementally talking about what they want to do in the world of healthcare, which I think is great news for all of us sitting over here in this country, because somewhere we are also sitting in the hub of technology, and this is a city, all the enterprises that are sitting over here, many of them are already working with many of these enterprises at the back end. So this can become revolutionary for India in terms of anchoring the big change with these technology companies to actually deliver the next wave of healthcare. Microsoft has done a lot over the years. If you take a look at where the amount of work that they have done, particularly with their Azure applications, and the work that they are doing with multiple healthcare provider groups in the US. So Johns Hopkins, St. Luke's, Kaiser Permanente. Microsoft is working with all of these large healthcare players in the US, just working on creating new healthcare innovation. So I'm actually super excited with this massive transition that we can actually do in the world of healthcare. This is an industry and this is a sector which has, for a long period of time, and rightly so, obsessed with brick and mortar healthcare. This is also an industry which has been superly hierarchical in its thought process, and that's basically because of the way that medical education itself is, that the transformation that is required behind this sector has not really happened as much as it should have, given the size and scale of the sector that we have in this country. So this integration between the digital side of what we can do, along with the brick and mortar traditional healthcare delivery assets, is probably India's biggest opportunity of healthcare change and innovation. And as we begin to look at whether these are large tertiary care, quaternary care healthcare delivery systems, single specialty institutions, diagnostics, you look at the entire world, and of course, then there is the world of pharmaceutical and biotechnology and everything that's happening in under the CCAMP ecosystem. Everything today has a great opportunity to move forward and accelerate on the back of this digitally forward care delivery ecosystems that can get created. Just to give you a quick roundup, India's health tech market in 2020, and again, this is historical a bit, but was about $2 odd billion as a sector. Effectively, right now, when I looked at some of the latest numbers, we are somewhere in the region of about 3.5 because of the massive activity that's happened over the last 2 years. But 50 billion is what the industry predicts itself that it can go to. Now, that is transformative. And this is achievable because of the massive push that the world is giving to the idea around healthcare innovation, to the idea around tech enablement, to the idea around digitization. So I think we're sitting on a journey which is going to be very exciting for all of us, particularly the people over here who all come from the technology world. If this is convergence of some kind, then there is a massive bioconvergence which is going on around the world. The interface point of biotechnology, engineering, medicine, suddenly engineers are creating the future of healthcare, which I think is a very, very exciting time. So thank you very much, and it's a pleasure to be here.